This topical cream is used specifically to treat rosacea, a type of adult acne. It helps to reduce the symptoms of rosacea, including redness, swelling, and pimples. It is recommended to apply the cream once daily, preferably in the evening, after washing and drying the affected area. Before you start using ivermectin cream, make sure to read the patient information leaflet and instructions for use from your pharmacist. This medication is specifically for use on the face, so it's important to clean the affected area with a mild soap or soap-free cleanser and then pat it dry. Your doctor will likely direct you to apply the cream to the affected areas of your face once a day, using a pea-sized amount for each area. Be sure to spread the cream smoothly and evenly in a thin layer. After applying, remember to wash your hands well. It's important to avoid getting the medication in your eyes, inside your nose, or on your lips. If this happens accidentally, rinse right away with plenty of cool water. For the best results, use this medication at the same time each day. Using larger amounts or applying it more often than directed will not speed up the clearing of your condition and may increase the chance of side effects. It may take several weeks of continued use before you see the effects of this medication, so be patient. If your condition does not improve or worsens, be sure to inform your doctor. If you experience skin irritation such as redness or a burning feeling, it is recommended to consult your doctor or pharmacist. It's important to remember that the benefits of using this medication outweigh the potential risk of side effects. Serious allergic reactions are rare, but it's crucial to seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's also important to note that this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. And in Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using ivermectin cream, make sure to inform your doctor or pharmacist about any allergies you may have. This cream may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. It's also important to discuss your medical history with your doctor or pharmacist before using this medication. If you are pregnant, this medication should only be used if clearly needed, so make sure to discuss the risks and benefits with your doctor. For those who are breastfeeding, it is unknown if this form of ivermectin passes into breast milk, so it's important to consult your doctor before breastfeeding. When using ivermectin 1% topical cream for acne, it is important to be aware of potential drug interactions. This could affect the way your medications work or increase the risk of serious side effects. It is important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication routine. If this medication is swallowed, it can be harmful. If an overdose occurs and serious symptoms such as passing out or trouble breathing are present, 911 should be called immediately. Otherwise, contact a poison control center. U.S. residents can reach out to their local poison control center at 1-800-222-1222, and Canadian residents can call a provincial poison control center. Symptoms of an overdose may include rash, swelling, headache, dizziness, vomiting, diarrhea, numbness, tingling, or seizures. It is important to seek medical help if any of these symptoms occur. It is important not to share this medication with others. For those using ivermectin 1% topical cream for acne, it is advised to avoid spending too much time in the sun, as this can worsen the condition. It is recommended to wear a wide-brimmed hat and use sunscreen when outdoors. Other triggers that may worsen acne include wind, hot beverages, spicy foods, alcohol, and extreme temperatures. It is important to be mindful of these triggers and take necessary precautions to manage the condition. If you forget to use ivermectin 1% topical cream, use it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and continue with your regular schedule. Do not apply a double dose to make up for the missed one. Make sure to store this Ivermectin 1% topical cream at room temperature and away from children and pets. Do not dispose of this medication by flushing it down the toilet or pouring it into a drain unless instructed to do so. When this product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.